Good morning, everybody, and welcome to another program in our series of webinars. This morning's title is Supporting Older People to Live Independently. Research indicates that home-based caring is the preferred option for many older people and for their families. A recent survey of active retirement in Ireland found 82% of those surveyed had a clear preference to aging at home in their own communities, with just 1% saying they would opt for long-term residential care. Government also indicate a preference for home care as it is the most cost-effective method. In this webinar, we will look at the supports, government policies and initiatives currently in place to enable this. We will assess the need for further resources if necessary to turn plans into actions. What role can communities play in delivering these services? So I'd like to introduce you and thank our guests for being available this morning. Firstly, Mary Butler, Minister of State for the Department of Health, with special responsibility for mental health and older people. She's Minister for State, as I said, representing her Waterford constituency, better mention that. She served as chairperson of the Joint Oireachtas Committee for Business and Enterprise and Innovation, and through the dealings with Irish Rural Inc. over the years, has been extremely interested in this particular area. She served as a councillor and clearly brings a great deal of experience to this very sensitive subject. Mark Hazard, you are also welcome. Mark has joined Macaulay Place, a housing initiative, as General Manager in 2012. After it had opened its doors to the public, Mark manages a team of 18 and 70 volunteers, and of course volunteering is a major part of this work. Geraldine Ryan, thank you for joining as well. Geraldine is with Cope Galway, and as you can see from behind her, community catering, Meals on Wheels, and as you will find out, many other services in terms of what Meals on Wheels bring. So Geraldine will bring to us the unique community and voluntary side of things, and of course, some of the realities out on the ground as well. So I would like to welcome all three of you this morning. As listeners and viewers will know, our webinar series are about bringing light on the subject, bringing information on the subject, and in that sense, we like to take it from there. Just one thing to you who are coming in, I see already there's somebody coming in with a question, I think. On the chat button, those of you registered, you will be able to ask a question, and we'll try and filter that to the guests and deal with it as possible. The other thing to say that this will be on our YouTube at the end of the week, and you can watch it at your leisure. So, Minister, I really will start with you. Thank you very much for coming on board. You're very busy, and I know you might have to rush out to the Shannon near the end, so we understand that. Minister, in terms of your responsibility for this area, especially older people, how do you view and how does the government view the whole notion of people wanting to stay at home?
Good morning, Seamus, and good morning to Mark and Geraldine and all the people that have come on board to listen, and a special hello to, I see James Farnham from Waterford Older Persons Council is on board, a very, very active Older Persons Council, so a shout out to anyone listening from all over Ireland. Thank you for your very warm welcome, and I want to compliment Irish Rural Link firstly for holding this series of webinars. They're very, very informative and they're very innovative, and I suppose it's great to bring like-minded people together to discuss how we can get the best out of government policy, community policy, and how we can reach out to our older people. That's the most important thing. From my own point of view, and Seamus, you give me the nod when you want me to finish, please, because I'm not keeping an eye on the time. Since I was appointed Minister of State for Mental Health and Older People on the 1st of July, for the past 4 years, I was opposition spokesperson for older people, and I also chaired the All-Party Committee for Dementia. So I have a huge interest in older people and the care of older people. My priorities are firstly and foremostly, and I suppose for anyone who would have looked up my background, they would have seen I spent the last 4 years on the opposition benches shouting about home care supports, the waiting lists, and the lack of support on Saturdays and Sundays, especially in rural areas, which is an issue that I'm trying to come to terms with at the moment. I suppose the first thing I did was to try and have an effective budget, because if you don't have extra money, you can't affect change. And I was delighted to secure 5 million extra home care hours in budget 2021 at a cost of €150 million. So that means we will be delivering 24 million home care support hours next year. I agree completely with the statistics you used about 82% of people want to age at home. I believe even that the majority of people want to stay at home, but they need the correct wraparound supports so that they can live safely and securely in the comfort of their own home. So that's my first priority. My second priority is keeping our elderly safe in nursing homes, because 25,000 of our elderly live in nursing homes. 80% of nursing home care is provided by the private sector, 20% provided by the HSE. The pandemic bore down hardest on our older generation, and unfortunately in the first wave, 54% of all deaths happened in the nursing home sector. We have put in place a huge amount of supports to support nursing homes over the last 6 months, and I suppose, excuse me, in relation to serial testing of staff every 2 weeks, supports, financial supports under the temporary assistance payment, and huge supports in relation to infection prevention and control. And so I just think it's very, very important that as we come through the second wave of this pandemic, very important that we support the small percentage of our older people who live in nursing homes. Something that's very, very close to my heart also is people who have dementia. And as we all know, we currently have 64,000 people with dementia in Ireland, 11 people every day diagnosed with dementia. So of the supports that were secured in the budget, 250,000 home care hours were ring-fenced specifically for those with dementia. And I'm very proud of that. And I also managed to secure 12.9 million in funding. I made a breakthrough this year in relation to dementia advisors, because it was a postcode lottery prior to this. But by the end of 2021, we will have 30 dementia advisors throughout the country, and every single constituency area will have a dementia advisor. Another key priority of mine, which is hard to achieve at the moment, and we were making great progress in September, is the reopening of daycare centres and the reopening of community facilities to support people in active retirement groups. What we were doing all during September was we were doing a risk analysis of every single premises, looking at how people travel there. And so as we all know, these kinds of supports are vital to older people who are living alone, especially in rural communities. Unfortunately, with the second wave, that hasn't been possible to do. So that's something we're working on a constant basis. So I'll leave it at that for now, Seamus, and I can come back in at any stage.
Mary, thank you very much, Minister, and certainly the announcement that there are dementia officers in each county, that is a really welcome, because of course it is unfortunately a situation where many families are confronted with dementia and they have to deal with it, and as usual for them it's the first time, so this is very welcome indeed. Geraldine, if I may go to you, you're representing COPE in Galway, but you also know a lot about a network for Meals on Wheels as well. In terms of, I suppose, the reality for people, especially in rural areas, what are you seeing and what's your priorities as you see it?
Morning, everybody. Yeah, so Seamus, we deliver senior support services and meal delivery services, but also lunch clubs around Galway City and Galway County. And we have several community support workers in place in communities as well. So it is really on the ground. And I suppose it may still come as a shock to some people to know that malnutrition is one of the greatest threats faced by older people in Ireland. And I suppose we have, our approach, I think, is we have been working very hard to change our approach to the delivery services so that they're not a reactive service, but a different approach where they're in place as a preventative. So very much as part of the integrated care package in communities and home-based. So that's really important for us. And together, all the community and voluntary groups are working and striving really hard to offer more access for older people at home to our services and to for people to embrace them and to use the sports that are there, but to have access to those services throughout the week, and regardless of where you live in rural Ireland, that you should be able to access those services. So that's really, really important. And our aims to do this and to grow and to scale our services are so that we reduce that risk of malnutrition, but also the social isolation. And so malnutrition isn't just, you know, reasons that can lead into that is that social isolation, the lack of social contact, the anxiety that people are living with, you know. So, and also by our services, we want to increase the health and well-being. So taking a positive approach to it again, increase the quality of life for people living at home. So it is wonderful to be at home, but you have to have all of the services surrounding you, accessible to you, and to be able to continue to have people living at home. And this all in line with the Sláinte Care Plan. So everything we do. And we'd like to, you know, ask government to maintain the close links with community and voluntary services in the social care sector in delivering in their programme for government.
That's grand. Thanks, Roisin. And I'll come back to you to delve more into the situation of services that you provide. Mark, housing, maybe it's not the first thing that jumps to mind, and yet to me, it's all important in terms of older people, etc. I know of many situations where people live, unfortunately, even today's age, in inferior housing. Tell me about Macaulay Place and what it does and how it could be replicated.
Thanks, Seamus. Yeah, look, thank you for the opportunity to speak about Macaulay Place. I suppose we look for any excuse to speak about it because we're so proud of it. But to give you a brief insight how it came about, our founder, Margarita Solon, was a geriatric nurse and would see, I suppose, elderly patients that would be going from hospital straight to a nursing home, and always felt there should be something in between. So this concept came into our mind in 1997 and formed the organisation in the year 2000. And I suppose it took 11 years to get to the completion of the complex, etc. The site was donated by the Sisters of Mercy. We're located in the Convent of Mercy building. And what we consist of is 53 apartments for elderly people, a community centre, an arts and culture centre located in the old Nuns Chapel, and a community garden as well that's open. It's a woodland garden, very natural effect, and it's a sensory garden that's open both to residents and the community. As I say, the mission statement of Macaulay Place is to provide independent living for elderly people in the heart of a vibrant community. And the vibrant community is everything else that we do. The convent tea rooms is what we have as well, which is everything served in fine china and nice setting open to the community. Social interaction is a big part of Macaulay Place, and I suppose I use the analogy that Macaulay Place is a bit like a college campus for the elderly, that they can come and go as they please. They can get involved in as many events, etc., as they want to. Like we've craft group knitting at night time, and the group that knit, everything that they knit is donated to Macaulay Place and they sell it. So what we found is over time that the residents are extremely proud of their independent living, and I suppose at times might bat me on the knuckles if they felt I was deviating from that. But over COVID, I suppose in particular, the first lockdown, the cocooning certainly had a dramatic effect on all elderly people naturally. But what we found is that the residents really struggled with it. Because I was concerned about mental health, etc. Where we're located is a very central location. It's in between the parish church, the primary school and the secondary school. And the secondary school permitted us to arrange outdoor gigs for residents to view from their balconies. And we actually had 35 gigs over the course of the first lockdown in March, April. And we had everything from a soprano, the local, well-renowned soprano, Celine Byrne, who sang them, etc. And that was a huge, I suppose, release, something to look forward to every day for residents. As they come out of the cocooning, etc., it certainly has had an effect on their mental and physical health. I've seen a deterioration in both. It's certainly a concern. Thankfully, the current level 5 has taken a softer approach to elderly people, etc., and they certainly welcome that, and they certainly have more freedom than they we had in the previous time. We're delighted that through the whole COVID that we've had one case of the virus here. We introduced a very severe sanitizing program from early March, and as I say, we 53 apartments with 60 residents and one case of the virus. So we're delighted, and I suppose long may it continue that the virus remains outside our building. So that's really in a nutshell, Seamus. I hope that's given you a good insight to what we're about.
Well, certainly we will be exploring the housing a little bit more in terms of how it can be replicated. Minister, I see a question from Rena Lochon Abbey. She's talking about the additional home care and how it will be allocated. Is it the public or private sector? Just to take that question, if you can.
Hi, Seamus. The question is how will the home care hours will be rolled out through each CHO. So it depends on which CHO you're living in. So I give you an example. CHO 5, where I'm from, so it would be the southeast. 26% of all supports are provided by private companies, 74% provided by the HSE. So it's the HSE would have the initial rollout, and they would have to outsource for capacity to the private sector, but it will be run through my department and the HSE specifically. And then, so in some cases, for example, in the Dublin area, for example, all home care is provided either privately or voluntary, whereas the best of the class is up in Donegal, in that particular area, where only 19% is privately rolled out, 81% is through the HSE.
Well done. Just on the general terms of policy, you said, I suppose, that quite successfully you've managed to increase the budget, which I think is a credit to you, because you're right. It's very difficult to be a minister if you don't have a budget. How do you see as a country, and I'm not talking about you just as a minister, because it's a wider future problem almost. How do we start looking at resources in this area in such a way that we take a clear decision that caring in the home, as was shown by that survey, it's the first option everybody wants. So how do you see us as a society and you as a government aiming to achieve that principle?
Well, I think, as Geraldine mentioned there earlier, the whole premise of Sláinte Care, is in relation to supporting our older population to live at home safely and securely in the comfort of their own home. In order to do that, you have to have the correct wraparound supports, but it has to be a whole of government approach. It's not only the Department of Health. And as Mark outlined there about Macaulay Place and the fact that they have 60 residents living there at an independent level. So we have to have cooperation between the Housing Department, the Department of Social Protection, the Department of Transport, and the Department of Health. There was an interdepartmental agency implementation group set up in 2019 to look at housing options for our ageing population. And I do know, for example, that Minister Donnelly has met with Minister Darragh O'Brien, who's the Department of Housing, to try and progress this, because it's hugely important that people can live independently. I spoke with a constituent yesterday who has a standard 3-bedroom semi-detached house, but she's in her late 70s now. All her family have flown the nest, and she would like to downsize, and she would like to, something like what Mark was talking about, that style of independent living, where you still have your own front door, you still have your own key, but you have those extra supports. And I think, government policy, that's the way I would like to see us progressing.
That's brilliant. Yeah, I know there's been different initiatives around the country in terms of housing. And I think we'd like to, Geraldine, just on the supports to Meals on Wheels, okay, just describe, it's more than just Meals on Wheels, Geraldine, isn't it? It's a much fuller and holistic service in a ways. Can you just give us some examples?
Absolutely, Seamus. Yeah, the meal is a really important part, and and that it has the correct nutritional value, of course, is really important as well. But the delivery of the meal and the social contact there, and I have to say, we have a huge cohort of volunteers that support us in our work, and also members that are on community employment schemes that are part of our service, and that is great. So it is that check-in. It's that check-in the day. It is that chat. It's that social connection. And, recently we have a really good example where there's a woman living on her own, very active, a retired healthcare professional, and she's 91. And it was her birthday, so there was a little, a little extra fuss made and birthday cake delivered with her meal. And, she rang us afterwards, and, she said she absolutely loves her meals. She's feeling great. She's still able to go have her walks and everything because she's looking after her muscle mass and her bone density. But she referred to, and the volunteers, she said, the delivery people, she said, they're my friends now. That's exactly what she said. They're my friends now. And this lady has, just to mention as well, she has 4 adult sons, all of retirement age, all living away from her. And another lovely connection is that one of her sons actually orders on behalf of her. And so that has changed, even the dynamic of their relationship. So they have lovely conversations and twice weekly check-ins, discussing the menu and making the plan for the week, So that's a real positive outcome of it. But this is what we hear over and over again. It is that check-in. We have several examples where somebody might call back into us and say, somebody wasn't looking so well or not presenting as their usual self, and we'd follow up, with a family member then, or with the public health nurse, whichever the case may be, whoever is listed there. So it's really good,
Thank you, Geraldine. I see you might know Brendan Mullery. He's asking, you've just done it, and a greater explanation for Meals on Wheels, so thank you for that. Mark, I've seen someone from Kildare also talking about the housing, and I'll come to that person in a moment. But Mark, I certainly, is there enough of the kind of housing you're talking about around, or what would we need? What do you see the model you have as the model, or are there other models? Where are we in terms of developing thinking on this one?
We've had many visits, Seamus, to be fair, from I suppose voluntary groups around Ireland that have come to visit Macaulay Place with a view to going back and replicating it in their town. There are quite a few derelict convent buildings around there for sure, and parochial houses as well. And I think, I suppose there's a lot of a commitment to it. And we received CAS funding for the building of Macaulay Place, which is 95% funded, and 5% was funded by the I suppose fundraising by the community of Naas. Like so many people have said that the Macaulay Place model should be rolled out across the country. It cost 8.2 million, I suppose, to build the complex. And I know a lot of groups that have come and visited us have met many stumbling blocks and haven't, I suppose, got to the final furlong. The Respond would be a good example of, they have a fantastic complex in Waterford City. That would be a larger complex even than ourselves, but it has all the facilities that we're talking about there, from a lovely tea rooms to community centre, etc., and a lovely site. I know it's been replicated to a point, but I certainly feel that there could be far more. And I don't know whether it's funding or what the situation is, and I am aware that there is quite a bit of CAS funding out there currently, where we're looking at expanding on our current site in conjunction with the Sisters of Mercy, etc. So yeah, there's certainly huge room for expansion and improvement on these type of facilities around Ireland. Yeah,
Denise Croak, who says hello to you, Mark, as well. But she raises an interesting question, Minister. I'll go a bit to you on this. It's a long, so keep your questions briefer, because I can't read every line in it. But really, with all her voices in Kildare, she's talking about a service, I suppose, where people can talk. And I know there are a number of services provided by Alone and other organizations like that. I suppose reaching older people and making sure they get the right advice, and even their families, is a big issue as well. I know that's something you're very strongly in the middle of in Waterford, etc. So how do you see that progressing under government policy and ideas?
Thanks for the question, Seamus, and thanks for everyone who are sending the questions. If I could just say initially, I just want to compliment Irish Rural Link and the way they drive the whole Meals on Wheels initiative. Because Meals on Wheels, as Geraldine has said, is so much more. It's so much more than just nutritional meals that's been dropped. Like, it's also monitoring services for the recipient, because if that person isn't there to receive the meal straight away, the person, the volunteer who's delivering the meal, knows there's an issue there. And secondly, you know, that person can also engage in a short conversation, but they can also direct the recipient to other appropriate services if that's required. So that's hugely important. And I just want to compliment Geraldine on the work you're doing. Meals on Wheels they're just such a phenomenal initiative and hugely important. But to answer your question in relation to you know, and Mark has touched on this as well. So at the first stage, the first initial lockdown, prior to I becoming a minister, we were in the cocooning stage. And in fairness to our elderly population, our elderly generation, they were so stoic, they were so accepting, they were so resilient. But it has certainly had an effect. It has an effect from the point of view of anxiety, low levels of depression, but also from a real loneliness element. And the loneliness task force that was set up recently, and I've checked this out and it will be funded again through Sláinte Care. That is a huge initiative. There's a couple of small pilot programs that are running out throughout different local communities, a kind of a befriending process, you know, a friendship process, which works really, really well. I'm familiar with the one that was run from the Déise Daycare Centre in Dungarvan, for example, where what they do, and we run another one in Waterford City, and what they do is, you know, a person would make themselves known that they would love to be befriended by a particular person. So a lot of work is done in the background for us, because you have to do all the checks and balances, and you have to make sure that, you know, there's no issues that a vulnerable person might be exploited in any way. But you have volunteers, similar to the Meals on Wheels, volunteers who might befriend that particular person for 1 hour a week. And I would love to see that rolled out more through our community. It's very difficult at the moment, because obviously our older people, they have to form a bubble with one other family in order to have the support they need to get them through this initial lockdown.
Yeah, it's really a great challenge at the moment. By the way, Denise Croke is sympathising on Waterford's problems at the weekend. I presume that's hurling.
We could have won it though.
There you are. John Johnson, Mark, is basically asking, how are you supported by the HSE? And I suppose he asks an interesting question. What happens if independent living is no longer possible? So can you take that question?
Yeah, first of all, I know John Johnson. He was a former member of our board, and he's a great friend of Macaulay Place. So how are you, John? Yeah, I suppose, again, back to the independent living. A good few of our residents would be supported through the HSE in relation to home help, etc., home care. From a legal point of view, I suppose we have a lease agreement with our residents, and in it states that if we deem them not capable of independent living, we I suppose liaise with family to arrange alternative accommodation. But in hindsight, that in reality, I suppose that's not realistic here. And what we found over time is that we would like our residents to continue to live here if there's a deterioration in their health, once they have the supports from the HSE in place. And that's normally done ideally through family. Naturally, we have some residents that wouldn't necessarily have a family, so we try and do our best to support with the connections we have with the HSE. But it certainly, our residents would always deem to us that this is their home, and they want to live and die here. And I suppose up to whatever point we can assist with the support of the HSE to allow them to live here for as long as possible. That's what we're doing, and it's working. It's working well, and I mean, they're very proud of where they live. It's a very much they treat the 60 residents here, and they say we are family. That's how they treat it. It's very much their home, as in encompassing all the apartments. But yeah, there is good HSE support for our residents, arranged directly by the residents through the public health nurse, etc. We, as I suppose to quote our founder Margarita Solon, we don't provide care, but we do care for our residents. So we assist as best we can through the avenues that we're aware of, and it works, and it works well.
Yes, indeed. Thanks, Mark. Roisin Doherty is and Geraldine, I'm going to go to you on this. Roisin is talking about Solasvet, which clearly is about, I suppose, numeracy. She's calling for a numeracy and digital strategy for all. What she's really saying here, in my opinion, is she's trying to link a whole range of services that are needed by older people. In Irish Rural Link, we have the Citizens in Line programme where computer training is provided people, especially before COVID, free, and it's still there online, operated, I might say, by volunteers. So in terms of COPE and Meals on Wheels networks, you would probably bring a lot of, or access to a lot of other services required. So how do you manage that? I mean, obviously volunteers are on the ground, they're trying to link in with people, but they're also discovering needs. How do you manage that?
Yeah, so I suppose, and just even to Minister Mary Butler's point as well, you know, within COPE, it's not exclusively the meal delivery services. So we also have, you know, those befriending services, and one of our programs called Helping Hands at Home does absolutely that. And we've seen the huge values that are as a consequence of that. So that's great. Age Friendly Ireland, we're part of that network, and that's really very supportive of bringing all the different groups together and all the different agencies and organisations together, both from community, statutory and voluntary. So there's really good network, and I think there's been a huge shift in that, in the more collective working together for supporting older people to live independently. And if I might, Seamus, just to go back, because I did see Brendan's question there afterwards. So Brendan did ask about, tell us a little bit more about Meals for Health. So we've been talking about Meals on Wheels and community catering. So over the last couple of years, we've taken a more innovative approach because we're recognising, say, the funding model isn't sustainable. And so we kind of looked at different model and, to keep meals affordable. And I suppose maybe not everybody realises that older people do pay for their meals. And that's really important to say. And the value that's attached to that as well is really important. So we have taken more of a social enterprise approach. So any surplus that we hopefully will make from our meals services goes back into supporting our other senior support services, such as the Helping Hands at Homes, such as the befriending, such as supporting to run and to set up our lunch clubs throughout the county and throughout the city as well. So all of those working together is, makes for a more sustainable service. And it's a model that can be replicated anywhere, so.
Thanks, Minister. As you know, and you'll be giving out to me again, we've been knocking on your door a good bit, even when you're in opposition, about the Meals on Wheels network and all of that. And clearly some groups are doing really tremendous work. They're even down as small as 2 and 3 people that set up to do a particular job, and then it gets very much expanded. And here's the real question. As we know from COPE, who do a fantastic job, and other organisations, we're going to need a lot more of this. So whether we like it or not, we really are going to need a lot more of it. There's more people staying at home. I see my friend Kim Smitherland from Finland is telling us that research in Finland shows that it is growing. The older people requiring services is growing in numbers in Finland. And basically it's going to be a serious issue in terms of care. The Meals on Wheels networks are a start. How do you see that developing, Minister?
Well, I think, again, going back to Sláinte Care, which is the whole premise of, independent living, supporting our older population to live at home safely and securely, Meals on Wheels is a huge element of this. And just one question that Geraldine might come back in a minute in relation to Meals on Wheels. Is it mostly, where I know of it, it's mostly Monday to Friday. Is there any weekend supports in relation to meals? If you wouldn't mind coming back in later in relation to that. And I just once again want to congratulate all the volunteers who work. And there's a huge amount of people on CE schemes throughout the country who work in a lot of the Meals on Wheels delivery, the community employment schemes, and they do a huge amount of work in relation to that. But I do believe we have to look at Meals on Wheels, I suppose, for want of another word, they can vary differently from constituency to constituency, from area to area, and I know, even listening to Geraldine, you could see how well that their community catering is, how well it works for them. It's done by volunteers in some particular areas, and I definitely think we need to put in place a kind of a structure that we could bring them all under the same umbrella, because Meals on Wheels is absolutely vital. And I know we're currently looking at nutritional guidelines for Meals on Wheels providers, so that you can put a structure in place that everyone can adhere to the best possible nutritional value. I know that's been done. But I just think if there are clear guidelines set out, it would support the organisation of Meals on Wheels to develop even more, because they're very, very strong in a lot of areas. But again, unfortunately, what I've been discovering and what I knew with a long time, a lot of supports that are available are a postcode lottery, and it's the one thing that drives me insane. I just want to make sure that wherever you're living, regardless whether it's rural or urban, you should be able to access the supports you need. That's the only way we can keep people in their own homes. They have to access the support. But just because you're living at the foot of the Cumbre Mountains, or you could be living out in Connemara, you know, you have to be able to access those supports regardless of your address.
Well, as you will know, Minister, there's the goods of 300 Meals on Wheels groups in a network affiliated to Irish Rural Link, and they're doing fantastic work, and I want to publicly thank them for the work they're doing. And I think they have the ability to share knowledge, to share best practice, to improve, and really to work with so many other organizations in order to perfect the service delivered. So you'll be hearing a bit more about that, Minister, I'm afraid. Going back to you, Mark, there are people looking in who might say, you know, we need a housing solution in our village, in our town, or our area. What would be your advice to them? Where would they start if they were to try and provide that solution?
Yeah, I'd say we're affiliated with the Irish Council for Social Housing, and that's where I would start with it. We received funding back in 2008 from the Department of Environment through Kildare County Council, and as I say, it was 95% funding of the whole build. The remainder 5% was the community and ACE that came together, and it was in the good times. I think it was kind of 06, 07, and they fundraised a substantial amount of monies at the time. But I would start with Irish Council for Social Housing. They've been a huge link and a support to ourselves and a lot of housing associations. I suppose, to be clear, part of the CAS funding is that we provide 75% of our facility is social housing and 25% is private. So that's a key part of the CAS funding. It's mixed tenure. It works really well. We charge key money entrance fee for up to 45,000 for a new private tenant. Hugely important in relation to the financial support of our organisation, and because we're a self-financing entity right now. We receive government funding at the beginning, and really we're working it on our own now, and it's very viable.
Yeah, I think I certainly know of initiatives that started way back even in the 70s and 80s that are still going. Mount Bolus in County Offaly, my own county. I also know about Kilnalek and Cavan, and there are plenty of examples around the country who've actually made an attempt to provide a solution. But I certainly had answered one question, which, you know, if people are living in their house, but they need a mixture of maybe semi-independent living, and certainly in those kind of housing projects, they get the benefit of being independent and yet being close to services or others who can help them. And I think that's, so I think people listening in, go to the Irish Council of Social Housing and start there, or probably go to your local authority as well. Or I won't say right to you, Mary, but I know if they do, they'll get help. But I think people should really look at that. Miriam McKenna, who runs the transport service in Meath, is looking for specific Flexibus for a specific kind of service, Minister, where older people, now maybe this is a question for NPHET, we should have them on sometime, but it's a solution where older people can go to shops at certain periods. It A, gets people out, and B, there's a certain amount of security. I think she's written to you as well, and probably to other ministers, knowing Miriam. How do you feel about that as a possibility or an idea?
Yeah, I did receive correspondence from Miriam and also through Sinead in your own office, Sinead Dooley, in relation to this particular request So it's kind of a collaboration between Local Link, which is a fantastic organisation from the transport point of view, and Miriam's ask was that, I'm just reading it here, that 2 hours will be allocated per week for older people to shop in a safe environment. Now there are many of the supermarkets and the shops that do that already. But however, it's not specific only to older people. They encourage people not to shop at that time, to leave them for older people. Unfortunately, and we've had the conversation, we sat down yesterday and we discussed this. Under my remit, I cannot tell a private company just to open for 2 hours in the morning between 11 and 1, just specifically for older people. However, I am going to write to them to encourage them to absolutely do that. Some of them are doing it already, and we've already seen that it's happening. There's often hours in the evening time in various supermarkets for children with autism, that they have a quiet time, they turn down the lights and they turn down the music, and parents can bring their children. So there is a huge amount of work being done. It's inconsistent though, it's not everywhere, that's the problem. And if we could just go back on one point, just your discussion with Mark in relation to housing.
Of course.
There is I suppose a type of residential care homes that are unique to the southeast. There's 11 of them in total, and it's a fantastic initiative, and it's not only in Waterford, it's in Kilkenny and Wexford as well. And basically what it is, it's the residential care homes, so they're for people who would have low impact cares. So I'm familiar with quite a few of them. So in most of them, there could be 30 or 40 residents. They would pay 80% of their contributory pension, or their non-contributory pension. So that would be approximately, the pension, as we know, is 248.30. So they would pay 80%, and they would have approximately €50 left. You know, I suppose, look, it's not pocket money, but you know, if they wanted to buy a paper, magazine, cigarettes, whatever. But this is independent living as well. Now, they don't all have their own individual key, but they would have their all individual rooms. And basically, it's specific for people who might be living in rural isolation, or that all their family might be deceased or might be moved away. But it works really well. They're run by voluntary boards also. And so basically what it means is, you know, they know they have their bed, they have warm meals 3 times a day. If they need any medication, it is given to them by a nurse who would be on duty. And it's a fantastic initiative in the southeast, and it's something I would like to see grow in other areas as well. But I suppose one problem that I have encountered, it is getting more difficult to encourage people to come onto boards, because there's so much governance.
Yes.
In relation to, and there's so much red tape, and I just find, and I don't know whether Geraldine and Mark have found this as well, and you yourself, Seamus, people are so busy with their own lives, and I'm talking pre-COVID now. It is hard to encourage people to come onto boards, because there are so many governance issues. You might comment on that yourself.
Yeah, I will comment on that, and I want to ask a question that Tom Lavin, our chairperson, is asking as well. But before I do, yeah, I think there is a big issue around how we train people into management and leadership. It's no longer enough, as you know, Mary, to people go on a management board without experience or without training. And I think in the old days, in the middle 90s, FOSS used to do a fantastic training program for people. I was on it myself, for people doing schemes, etc. And I think there's a strong case for that training to be made available, because while geniuses may be born, not everybody's a genius, as they say. So in leadership and in management, you do need help. Mary, Tom Lavin from Sligo is asking an interesting question, and I'm asking it you now because in case you have to go, you know, we're talking about post-COVID in terms of what will stick afterwards and what will not, and also government policy about helping people at home. He's asking the question, will we commit to doing research and development, like maybe through the SRI, he suggests, but there may be others. How do we chart a way to ensure that learning now happening continues? I'm going to go to you, to Geraldine, on that as well. But Minister, maybe, what are we doing in terms of research and development post-COVID?
It's actually an excellent question to ask, because I just think at the moment data is hugely important, and we have to learn, and we've learned so much. So obviously we have learned that, for example, in the first phase of COVID, cocooning wasn't the only answer, and that's why this time there is no cocooning. We're asking older people, vulnerable people, people with medical conditions, underlying conditions, you know, to use their own approach, a sensible approach, and you know, to limit their movements as much as possible, not to use public transport if at all possible, but that's not always possible. But I do agree, data is hugely important. So I know, for example, my department commissioned the Health Research Board to undertake an evidence review on housing with supports for older people. I have to say, I'm a person that loves spreadsheets. I love data. I think it's hugely important. It's the only way we can learn. I'd imagine the data will come out of COVID and prior to COVID, maybe next year. You know, like just to let people know, you know, we talk about trying to give supports. Currently, I'm dealing with 49 cluster outbreaks in nursing homes at the moment. We have 585 nursing homes. The HSE are offering support on site to 163 different residential care homes, nursing homes, homes with people with intellectual disabilities. We all know there's community homes throughout the country where you might have 6 people living there in secure accommodation. You know, so at the moment, whereas there is a huge emphasis on data in relation to NPHET, my core at the moment is to try and get through this stage, make sure the supports are there. But absolutely, data is so important. It's the only way we can learn.
Absolutely, and I thank you for that. Geraldine, you're dealing, maybe you're working through volunteers. I know on the Irish Rural Link we had our County Champions program where volunteers visited the homes if necessary, helped them deliver their own services, whether it was groceries, etc. What do you need in terms of research as well? Because things will not be the same again after this. There's no way.
Yeah, so I agree with Minister Mary Butler in that we do have to find, you know, say very clear measurement tools to collect the data. You know, we have a lot of impact stories that we can talk about over and over again, but we need to get the figures down on paper and to be able to transfer that then into a plan. And I also want to say, just to welcome the news that there is the research being done on the nutritional aspects of it. And also because I'm very conscious of our network, that it doesn't strike fear in the smaller groups and the voluntary groups when standardization is mentioned. We have really good examples of community partnership models where the community and the smaller groups are providing elements of the voluntary and the delivery part of it, and combined with other, say, supports for them to do that and to achieve that. I think it's really important that the Meals on Wheels and the community-based delivery services are put on the programme for as an essential service, so that we can help to support people.
I think so. I see Dave Fitzgibbon from Kerry. He's somebody who was our county champion. He's making the point in terms of soft support services. I think Minister, you're right in terms of helping people to go on management boards. In terms of housing initiatives, Mark, how do you manage, who manages the local boards, or in your case, have they to receive training, or do you require involuntary people who come in with experience, with management experience, etc.? And how do you see that driving forward?
Yeah, we actually had I suppose a transition period with our board where we had 5 new members join our board early last year, and a very detailed induction process was involved in it, and we had in a mediator to be involved in the whole training concept. So we were very lucky to get very very good professional people from different fields. So we've 10 on our board currently. The governance side of it certainly has increased dramatically over the years, and it's a huge element of responsibility that board members are taking on, and they're very aware of that, and that there is still a huge commitment to it. I think if you believe in the project, then everything else is immaterial, and I believe that all our board members are fully supportive of Macaulay Place, and like we have our chairperson as well, Jim Bly, who would put in a lot of hours in relation to this as well. And I think that you know, if you believe in it, you put the time involved in it. I know red tape, protocol, every type of data can scare some people off, but I think the benefits are when you see it in action, you meet the people on the ground, as in the residents, and that that you realise it's something very special, and that's why we've so many volunteers that have remained on board with us, etc. That they believe in it. It's a magical place. They say things like, when you walk in the door, you expect the unexpected, and that's something really great for the likes of our residents in relation to what's happening today. Well, that's naturally reduced during COVID. But yeah, look, it works well. We have a great board. A very intricate induction process was involved. Some of them they'd be coming from different fields. Some of them naturally would have previous board experience. Some of them don't and are here to learn, but they're being trained in as we go. And I think it works well, and that's how a board should work well.
Minister, I'm conscious, and this will be the last question I'll ask you, so feel free if you have to go afterwards. And in terms of last words as well. But I'm very glad to see that there are people from across Europe listening as well and viewing. I see Andrea Zeski talking about the situation in France. So we could learn a great deal from Finland and France and other countries like that. But really, I suppose, Minister, the reality in Ireland is that we depend on a lot of voluntary people, as you rightly say. We depend on, and yet we need to deliver services that people feel confident in. Let's face it, as an older person, and I suppose I'm moving that direction myself, I have to say, but not yet, I hope, in need of them. But somebody else might have a different view. But anyway, but you do need, if you require it, you need a service, you need a professional service. So over the next 5 years, I'd like to think there will be a real long-term plan in providing this service. So in last comments, Minister, how do you see this developing out over the next few years?
Well, I think, Seamus, you know, it's great today that we're having the conversation. It's hugely important. And if I might add just a couple, I just want to mention carers today, because carers are at home. They've probably been at home for practically most of this year, and they have found things extremely difficult. I held a small round table with carers about 6 weeks ago, and I specifically wanted to speak to people who were caring for an elderly person, caring for somebody who might have an intellectual disability, which, you know, as we know, during the pandemic, those services weren't available. Thankfully, they're back at a reduced rate now. And I'm just very conscious today, as we're listening, that there might be people listening in today who are caring for a loved one at home, and probably in despair. You know, they might get an hour's home care support in the morning, half an hour in the evening. You know, they're depending on the Meal on Wheels coming to their door. And I just think it's, you know, to be conscious of carers as well, because this has been a really difficult time. But you are quite right, you know, and I think we are moving in the right direction. So currently what I'm working on is the single assessment tool, the Intra-Race. So it's the rollout, and we're going to pilot it just before Christmas, I'm delighted to say. So this is assessment of need for any older person throughout the country. Currently, if you're being assessed for home care support, or whether you need to go into a nursing home, it varies from constituency to constituency, county to county, CHO to CHO. So we need to put in this specific tool that, you know, if you're being asked the normal 20 questions, I'll always remember my own father-in-law who has since died, looking for home care supports, and the question he was asked was, can you eat your dinner? And he said, I can, but he was never asked, can he make his dinner? And can you dress yourself? I can, but he wasn't asked, can you wash your clothes? So this single assessment tool is hugely important. It's something we've been working on in the background for a very long time. Another thing where I'm working really hard, and I know an awful lot of people online will be glad to hear of this, if they do need nursing home care support eventually, a fair deal for farmers and for small businesses. And I'm pushing really hard into the department. We're nearly there to bring the legislation forward. And I think that's hugely important as well, because there will always be a small population of people who need those kinds of supports. But to answer specifically, going forward for the next 5 years, and hopefully I will be in this role for a while, and I'll be able to deliver on these things. The correct wraparound supports for every single person who needs them, regardless of where they're living. That's my aim. That people can feel safe and secure in the comfort of their own home, that they don't have to be fighting and scrapping for a half an hour on a Saturday morning and a Sunday morning. These extra 5 million hours. So last March, we had a waiting list of 8,000 people who were looking for home care supports. The waiting list currently is down to 3,000. Now that's a huge movement. I won't be happy until it's at 0, and that's my aim, to get you to 0 very, very quickly. But for anyone listening, it's just for them to know that, you know, I'm very passionate about my role. I'm very passionate about care of the elderly. The correct wraparound support in their own home is what I want to aspire to.
Thank you, Minister. Quick question coming in from Jared Costello. Will daycares open soon, especially for older people?
Unfortunately, I cannot give that answer. As I said earlier on, we were hoping to open them in September. That was our plan. A risk assessment was being done of every single premises. It won't happen before Christmas. There's no point me. I can't pretend it will. It's not even, you know, the risk assessment has been done. We mightn't be able to have as many people in. It's also the transporting of the person if they were being transported in buses. Hugely conscious also, as I said, of the active retirement groups who used to meet weekly, monthly, the knitting groups, as Mark referred to. All the, you know, they play bridge, they play different things. During the summer, I know of one organisation who played bridge. They played outside, socially distanced, out, you know, but that's not an option at the moment. But, you know, that is something I think of every single day. My own mother is 83 and she attends the Portlaw Daycare Centre and misses it so much and misses her friends. So I'm acutely conscious of that. And as soon as it's safely possible to do it, I guarantee people it will be done. Listen, if you don't mind, I'm going to have to leave to go to the Shannon. And I just want to thank everyone for the time. And once again, I want to thank Rural Link for all the work you do for older people. You know, and I want to compliment Geraldine and Mark for all the work you're doing also in relation. It's great to hear about the different initiatives throughout the country. So thank you very much, Seamus.
Our sincere thanks to you, Minister, and please, apologies for keeping you longer, but look, you have to go, and I really appreciate. We will be back to you, I'm sure. Absolutely. So I appreciate that, and thank you as well. So we'll continue for a few seconds later on. At the moment, Geraldine, some last comments from you in terms of, you know, daycare centres are important for older people as well, and I'm sure you see that in your everyday work. But it sounds to me like we are only at the beginning. So in your dream world and your wish list, pick out one of them and see, can you, what is your understanding of what you would pick if you were in the minister's seat?
So I think it's what's really important in the message that we leave with today is that we really, for all of the network, is that we really need to be positioned as an essential social services with adequate state funding and part of the programme for government.
Good. Well, that's as I wanted, nice and succinct. Mark, we know the minister's commitment has been fantastic and all of that. If you were in her seat, what would you be looking at? Obviously, if it hasn't a housing dimension, I wonder. But anyway, what would you be looking for?
Yeah, I think social interaction is something that we I suppose we naturally realise is really important for elderly people, and particularly through COVID, etc. Volunteering is a huge part of housing supports out there as well. I think we need more Macaulay Places out there, and we need more government funding to allow them to be built around the area. And I know a lot of people are keen to do it. It works well as a model. It allows for a huge social interaction and intergenerational activity with local schools either side, etc. It would be deemed a non-medical model, as quoted by our founder Margarita. And I suppose the longer that we have residents living in our facility, the less of an expense on the state if they're moved to a nursing home. So it's a hugely important model, and it definitely should be replicated as much as possible with government support.
Well, okay, we'll leave it there, Mark, with the last word. Thank you. Obviously, I've said thanks to the Minister. As you can see, those of you who are listening in, I couldn't cope with all the questions coming in, I have to say, which is a great thing. It tells me that the interest in terms of the future of older people, and let's face it, we're heading there, some of us getting there sooner than others, but we're all in that direction. So therefore the services required will be immense. They will need to be professional, and they will need to be properly organised, based on solid research and based on a commitment by the government of not just today, but of future days, to make sure that they're doing that. So we will certainly come back to this subject, and I think we could have had a webinar on housing alone. We could have had one on Meals on Wheels alone. We could have had a webinar on any single issue that was raised here, and maybe we will have a look at that. But next week, I want to ask you to join in on the 26th, Thursday. We will be having our next webinar will deal with rural isolation. And rural isolation, it's a major issue, particularly among middle-aged and older members of our community, and also among our menfolk. Unfortunately, they have to try and cope with living alone as well. And we didn't even deal with that this morning, but it is a big issue. So I hope that many of you who are in this morning will join at 10 o'clock on Thursday of next week, the 26th, where we will have a range of guests from the Men's Shed and from others who will deal with this subject. To those of you who ask questions, we will try and make sure the Minister gets those questions. You can see this on YouTube later at the week. And if you're not joined with Irish Rural Link, well then make a pledge and give us a buzz, and we'll be quite happy to take a membership. It is important that we are making sure that we have rural, sustainable communities. People like to live at home, as they said in 90% of that study. That's where we'd like to see them as well. Thank you for listening and viewing. Good morning. Have a good day.